Cases are plummeting, and in other parts of the country, mask mandates are going out the window. Joining us live, Dr. Jeff Potoff, UW Health's Chief Quality Officer. Doctor, great to see you. As quickly as it came, Omicron numbers are right now nosediving. Fewer than 2,000 cases of COVID yesterday. 3 weeks ago, we were averaging nearly 19,000 cases a day. So what's happening in this pandemic, Doctor?
Yeah, I think, thankfully our Omicron surge came to an end pretty quickly. That was a rough period of time. I think that surge could continue to drop off. We might get to a place where we were going into last summer, where things were starting to feel a little bit more like normal. I think a lot of folks will then ask, well, what do we need to do with masking, distancing, things like that? And I think a time could come where we could look at not doing those things. Today is probably not that day. We want to get our cases down to about 50 per 100,000 people. We want our positive test rate to be a little bit under 8% to do that safely. But I don't think if we continue the current trajectory that it'll be too much longer before we get there.
I want to ask you about masks then, because we're seeing in states with Democratic governors, Connecticut, New Jersey, they're getting rid of their mask mandates or making plans to get rid of them, especially for schools. And in places like here in Milwaukee, you still got to wear your mask in school. So you're saying right now the masks probably should still stay on?
Yeah, especially right here. Now, if you look in some of these other places in the country, they are getting to that point where you can, question whether the benefit of the mask is needed because cases are so low. Some places like New Jersey, they're at about, 37 cases per 100,000 people. Positive test rates low. You can make plans to do away with some of those mitigation efforts. We were a little bit slower here in Wisconsin on our Omicron surge, so we're a little bit behind them in coming down. But assuming the trend holds, we could be talking about this in March.
I want to ask you about a word we talked a lot about at the beginning of this pandemic, herd immunity. Are we getting closer to that? That's the concept, that if enough people get vaccinated or enough people get sick, then the virus has nowhere to really go. And I know a ton of people who've gotten sick, and about 60% of Wisconsinites are now vaccinated. Are we getting close to that point?
I don't think we'll actually get to herd immunity, which is that there's so many people that are protected against the disease, either through vaccination or natural immunity, that basically the disease, COVID-19, would just go completely away because there's no one left to infect. With original coronavirus and how infective it was, we needed, 70, 80% of the population to be immune from it, vaccinated or otherwise. But unfortunately, with these more contagious variants, that percent of vaccinated or percent immune starts to go up. And with something as contagious as Omicron, we're probably somewhere in the 90% range of people who need to be immune for COVID-19 to completely disappear. So I think we'll still have COVID-19. I think it will hopefully be at a much lower rate. But the idea that we can eradicate it, I just don't see that happening.
How far we've come when we used to just call it coronavirus, and we didn't have these different variants that we called it. So where do you think the projection goes here in the next few weeks? I mean, could these numbers really drop down to when we were just seeing a few hundred cases per day? Or is this going to be the point where we see where this virus takes us?
Yeah, I think, we could still see a bit of a drop in cases. I don't know where that nadir is or that low point, but I am hopeful without anything on the horizon right now that would suggest a new variant that's going to cause trouble, that at least for a period of time, and longer would be better, that we can get to something that, more like resembles normal, where there isn't as much concern about gathering, mask wearing, things like that. I think that would certainly be something that all of us would just love to see here now.
This pandemic's been so unpredictable, so we'll see what happens next week when we talk to you. Dr. Potoff from UW Health, appreciate your time.
Thanks.